What's the rationale behind this new recommendation?
So the new recommendation is the first peanut-specific guideline dedicated to peanut allergy. And it describes that at around 6 months of age, infants should be given peanut-containing food in non-choking form and given it regularly, like you stated. And the rationale is because there's been a rise in the rate of peanut allergy over the past couple of decades. And the best explanation that we have is that the delay in introduction of peanut has likely caused that rise.
That's interesting. So why 6 months? Is there any problem to go earlier or later?
Well, 6 months is when solids are typically started, and 6 months is the duration of exclusive breastfeeding recommended by the World Health Organization. There is this 4 to 6 month narrow window where some studies are suggesting that there may be benefit to introducing foods such as peanut protein, but that requires a bit more thought as to how we can harmonize that with the breastfeeding guidelines. And so I'm involved in some discussions about that issue as well. But that's why, for now, we're saying around 6 months. I should add that the vast majority of these infants do not require testing and can be introduced to peanut protein at home. There's a minority of infants, well under 10%, who are recommended to have testing in the physician's office and possible supervised feeding in the physician's office. And that's described in the guidelines as to who and how to do that.
You know, though, I think back when my younger brother has a very serious reaction to peanuts. Every time we'd go for ice cream, it was always nerve-wracking. We'd have to get the scooper to go to the freezer and open up a fresh tub in case the peanuts had somehow contaminated the other ice cream. So the idea of knowing that, the idea of, saying, well, infants should, get a taste of peanuts, it just, you understand, it can make some parents and some family members a little nervous.
Definitely. And so that's the difference between doing a research study and following parents very closely in that versus trying to implement this type of recommendation in the real world. We're contending with, in the research that's been done, showing this, as well as in the actual clinics, quite a bit of hesitation and fear, understandably. But it'll require a lot of education that it's actually safer to introduce early, and the chance of having a reaction at that very early age in the vast majority of infants is exceedingly low. There's been countries such as Israel that have done that for decades very safely and have very little, if any, peanut allergy. And although these are American guidelines, we do have full endorsement from the Canadian Society of Allergy and Clinical Immunology. And part of my role on the committee was to represent the Canadian Society.
And so what would you say, what tips do you have for parents with infants?
So to just keep it simple, around 6 months of age, infants should be introduced around to peanut-containing foods, and then thereafter given ideally several times a week, if not possible, at least weekly for years. And the vast majority can start doing this at home. If there's concerns, then discuss with their physician.
How should they even know whether they should be concerned or not, though?
Well, the first time they try it, if there's a very mild reaction, and we describe that as a skin reaction, such as hives, that can be observed, and antihistamine could be given, and then there should be follow-up with the physician. If there's anything more than a rash, then that should be seen in the emergency or 911 immediately. But for these lower risk infants that I'm talking about, over 90%, they shouldn't experience a severe reaction. It would be very unlikely, and in a very unlikely event that happens, then go to the nearest emergency.
Still, the 10%, though, that's high enough for people. Do you think that, what about people say, well, maybe I should just do this in a physician's office?
Well, so that's exactly what the guidelines describe. And 10% is an overestimate. It's more likely even under 5%. So we're talking about the very severe eczema or the infants who at that young age already have egg allergy. Those should have the first taste of peanut in the physician's office. And there's exact details in the guideline as to how you get to that point. But that's how to contend with that highest risk group. All the others in that lower risk category can introduce at home.
And you think if people start doing this over a period of time, there are going to be a lot fewer people with peanut allergies?
I'm cautiously optimistic. Of course, the real world is different from a research study. And again, we're having to contend with hesitation and fears. And then when it comes to that small group that need the first taste of peanut in the physician's office, there is going to be a healthcare resource utilization issue because not that many practitioners actually have the experience and training to do the physician-supervised feeding of infants in the office or interpret the testing that can be done prior to that, which can be very confusing. There's quite a high potential for false positives.
All right, Dr. Chan, thank you very much.